Right now, we are watching a persistent problem affecting local families, one we've discussed here before on the broadcast. Moms are dying during or after pregnancy at an alarming rate. A new report from the Healthcare Policy Foundation, the Commonwealth Fund, shows on average more than 22 mothers die in or around childbirth in the U.S. That's for every 100,000 live births. That's more than twice what countries like South Korea and Canada are seeing, and 4 times that of the U.K., Germany, and Australia. And we're seeing the impact here at home. An average of 70 Missouri women die every year while pregnant or up to a year after childbirth. That is staggering, and health experts say the numbers are way too high. Kansas City, Missouri Health Department's working to do something about it, hosting a special summit just this month to try and come up with solutions. They brought together health officials and providers, politicians and policymakers. Some of the speakers even shared stories about fighting for their own health.
The system had let me down so many times, and even when I tried to advocate, even when my advocates tried to advocate, it still was extremely dangerous.
The speakers included the widower of a former Chiefs cheerleader who died shortly after childbirth just earlier this year. You know, this is an issue that has ripple effects for countless families, and there are several prongs to this problem and several causes to consider. Here to get to the heart of the matter, please welcome back Dr. Marvia Jones, Director of the Kansas City, Missouri Health Department. Good to see you again. Thank you so much for being here to discuss such an important topic. First off, let's tackle healthcare access, because we know that's a major hurdle for moms and can really mean the difference between life and death in some cases. Where are we right now? Where do we need to be?
Absolutely. One of the concerns that we continue to hear is that folks aren't able to get in to see a provider early enough so that their risk factors can be assessed. We can figure out where they are at their risk level so they can be treated accordingly before the childbirth period. Subsequent to that is after childbirth, there can be a number of factors or conditions that rear their heads, and so being able to get back in to be seen and to be treated accordingly can also be a concern right now.
You can't talk about access without talking about inequity, right? It's staggering. Black women are 3 times more likely to die in Missouri within a year of pregnancy than white women. How do you address this and get care to the people who need it?
Absolutely. So what we're really talking about in many of those cases is access to the things that allow someone to lead a healthy life in general. So access to transportation and being able to get in an appointment when you need one, and having the funding to ensure that you've been able to see a mental health provider where necessary, or to get treatment for different things that might be going on. We know that access to those factors is not equitable across our population, and so of course the impact that we see in terms of postpartum and prepartum impacts are different as well.
So how can your department help change these numbers?
Well, the beauty of the public health department is that we have the ability to really understand which sectors are involved in this problem or these problems. It's not just one. We have the ability and thankfully the reputation that can pull people together to at least discuss what's going on, from social services, the mental health community, behavioral health, as well as those providers of birth care services. So being able to pull them together to a place and say, all right, let's talk about the ecosystem that is impacting women giving birth.
Yeah, you mentioned mental health, and that's an important part of this, because, you know, we mentioned this last year, that it had eclipsed cardiovascular disease and homicides as the main cause of maternal mortality. Are you seeing that trend in Kansas City as well?
Yes, we are seeing behavioral health, mental health continuing to be factors that impact birth outcomes. And that can be things like people experiencing anxiety and depression, or some substance use, but these things should be flagged earlier on in the birth or pregnancy process.
Does that mean changing the rubric or criteria of local doctors? How do you get to these practices, these offices, and try to implement these changes?
For sure. So we know providers are incredibly busy. We continue to lose obstetricians nationally and at the state and local levels. We understand that providers are under a lot of pressure right now. Hospital systems are as well, to meet the needs of a population that has already been impacted by a pandemic, if you will. So we know that talking to them about implementing more rigorous screening processes is one step. Another step is making sure that when they screen someone and identify needs, that the system is there to meet those other needs. We don't want to just screen them if there's nothing there to serve them.
Right, and to follow up with them.
Absolutely.
As well.
Follow-up is important.
Mm-hmm. What came out of the policy summit that you held, or any actionable steps that you're taking?
For sure. One of the kind of low pieces of low-hanging fruit that came from that was that this system should really be communicating more clearly and more frequently as a whole. This shouldn't be the only time, or it really shouldn't have been the first time that we all came together to say, what are you seeing from your angle? How should we be better partners to each other? So that's one step, to continue to meet in that way. The team also did a great job, or those who convened did a great job of coming up with some policies that the local legislative bodies should be able to pursue, as well as some of those policies that should be pursued by organizations. And so thinking about local distribution of funding toward meeting some of those transportation needs and some of those other, what we call the social drivers of health, being able to allocate funding that really gets to the root of those matters or those access issues, as well as some of the policies that would require the work of our safety net providers. And then looking at some organizational policies, some of our takeaways were around screening and around better educating families about what to look out for, so that it's not just the patient who's educated about what risk factors they might have or what conditions they should be on the lookout for. Their family, their support system is also in the know.
Yeah, that's an important point. Dr. Marvi Jones, thank you so much.
Thank you.
We talk about resources for families. Well, the state of Missouri has an online resource for moms at health.mo.gov. Just search maternal mortality. You can also go to this website, and it's an important one, postpartum.net. It offers free online support groups and free educational materials for families in need.